people know what CPR is and that it can save lives, but did you know that fewer than 1 in 5 adults are CPR trained? That's only 20%. I'm here to give the other 80% of you a quick rundown on the basics of using CPR in case of an emergency. CPR stands for cardiopulmonary resuscitation. It's a technique used to help restore a victim's breathing and keep oxygen flowing through their blood if an injury or illness stops their breathing. CPR should only be used by those trained to do it properly and only as a last resort if the victim becomes unresponsive and stops breathing. In an emergency situation, your first step is always to call 911 or have someone do it for you while you check on the victim. First, check the victim for responsiveness by touching them or talking to them. It may be necessary to test for a pain response. If you're certain the victim is unresponsive, check for breathing. Open their airway by placing one hand on their forehead and 2 fingers under their chin and tilt their head back slightly. Just remember, look, listen, feel. Look to see if their chest is moving. Listen for the sounds of breathing and feel. Place your cheek over their mouth and nose to see if you can feel any air movement. It's not necessary to check for a pulse before starting CPR. When you're certain they're not breathing and you've called for help, you can begin CPR. CPR may consist of rescue breathing and always includes chest compressions. If you're not trained for CPR, skip the mouth-to-mouth rescue breathing and just perform chest compressions, about 100 per minute. Place your palms on the center of the chest and push to the beat of Staying Alive by the Bee Gees. If you have any concerns, the emergency dispatcher will talk you through the proper procedure until first responders arrive. Ha, 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 stay alive, stay alive.